Hi, I'm Dr. Thomas Gerber, Associate Editor and Web Editor at Mayo Clinic Proceedings. I'm also Professor of Medicine and Radiology at the Mayo Clinic College of Medicine. Here is my monthly scoop for you on the Editor's Choice and Highlights articles in the September 2015 issue of Mayo Clinic Proceedings. First of all, though, let me remind you that you can access the articles that I mention here for free on our website at least during the month of September, and some of them even for 60 days. Our Editor's Choice this month is an original article about the generalizability of studies that examine the treatment of depression. Dr. Mark Zimmerman and colleagues from Brown University in Providence, Rhode Island, reviewed the literature of the last 20 years, and they compared the inclusion and exclusion criteria of studies published from 2010 to 2014 with the inclusion and exclusion criteria of studies published during the 15 years prior to 2010. And even though there have already been concerns about the generalizability of depression treatment studies, the authors found that in the more recent studies, the inclusion and exclusion criteria have become even more stringent, in particular with respect to comorbid psychiatric disorders, depressive episode duration, suicide attempts, and the severity threshold on depression rating scales. Read the article to see what the authors think about the reasons for and the implications of their findings. There is a lovely editorial by Drs. Vinay Prasad and Vance Berger from the National Cancer Institute in Maryland that goes with this last article. They discuss what they call hardwired bias, which are subtle design choices in randomized controlled trials that can skew the final trial results, and they give suggestions on how to recognize such hardwired bias. One of our highlights this month is the latest contribution to our symposium on neoplastic hematology and medical oncology. The article talks about clinical aspects of essential thrombocythemia and polycythemia vera. Now, this may not come up in your practice every day, but please do yourself the favor of looking at this article. The article's author, Dr. Ayalu Teferi, has been one of our associate editors for more than 10 years, and he knows and teaches more and writes better about this topic than anyone I've ever met. I guarantee you that you will keep this article close by until you've read it completely. Our second highlight this month is a review article on the prevention and treatment of volume overload in patients with heart failure. Dr. Brian Houston and colleagues from Johns Hopkins University in Baltimore, Maryland, discussed the latest contributions to the evidence base for the management and prevention of fluid overload in heart failure. And this, of course, is very important because the majority of hospital admissions for acute heart failure decompensation are preceded and driven by congestive signs and symptoms that result from fluid and sodium overload. And of course, I don't have to tell you that heart failure decompensation is the leading cause for hospital admission in the United States and has a very high rate of readmission within 30 days. The third highlight in the August 2015 issue is a concise review for clinicians on non-celiac gluten sensitivity that was authored by Drs. Maria Vasquez-Rock and Amy Oxentenko from the Mayo Clinic campuses in Florida and Minnesota. The term non-celiac gluten sensitivity is applied to patients who develop gastrointestinal or sometimes extraintestinal symptoms after ingestion of gluten. Read that review to learn about the clinical presentation of non-celiac gluten sensitivity, its overlapping clinical features with celiac disease, and the current concepts in diagnosing and managing it. To read these and many other free articles, please visit our Mayo Clinic Proceedings website at www.mayoclinicproceedings.org, and while you're there, please take the time to connect with us on Facebook, Twitter, and YouTube so that we can keep you up to date on what's happening at Proceedings between the monthly issues. And we'll see you again soon for the October 2015 issue summary. Thank you.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.